High cholesterol is a very common problem in many Filipino households. In fact, 1 in 2 Filipinos have high cholesterol. And for the most part, it's a consequence of an unhealthy lifestyle. Marami sa atin talaga mahilig sa mga fatty foods o kaya sa mga sweets. So making simple life changes is key. In today's program, we'll help you improve your cholesterol and keep your heart healthy. I'm Dr. Freddy Gomez. This is MedTalk Health Talk on CNN Philippines. A healthy lifestyle comprises of many things: diet, physical activity, and of course, the most important, your mindset. It's more than just losing weight here and there. It requires a commitment to think and, of course, do what's best for you. Our guests are here today to help you make these healthy choices, and ultimately, our goal is to improve your cholesterol level. With us is Dr. Christopher De Los Reyes. He's the head of the Cardiovascular Cath Lab of Asian Cardiovascular Institute at the Asian Hospital and Medical Center. We also have Jake Brandon Andal. He's a clinical dietitian from the Philippine Society of Nutritionists and Dietitians. Thank you both for joining us today. We've all heard the term high cholesterol, but what exactly is cholesterol and what does this do for your body? Dr. De Los Reyes, before anything else, can you please explain this to our viewers?
Cholesterol is it's almost a wax-like or a fat-like substance that's very abundant in the body. It's also common in different sources. More importantly, the role of cholesterol is a very diverse one. No? So it doesn't only serve one purpose. To name a few, cholesterol is a very important substrate for the cell structural integrity.
That's right. So your body actually needs cholesterol in order to function properly. Now, if cholesterol is necessary by our body, Jake, why do we need to worry about it?
It's because yung katawan po natin, although kailangan natin ng cholesterol, no, medyo sufficient yung amounts ng cholesterol na nagagawa ng ating katawan. Meaning, napakakaunti lamang po ng cholesterol na kailangan natin sa ating diet. Kaya po ang nangyayari pag po sumusobra yung pagkonsumo natin ng cholesterol, ito po ay nagli-lead sa plaque buildup sa ating mga arteries. So this is the reason why we really need to look into how we can lower down our cholesterol intake, because again, a huge portion of our cholesterol needs can be met by our own production of cholesterol.
So too much of heavy cholesterol in your bloodstream can put you at risk, mainly for heart attack as well as stroke. Now, unfortunately, many of those who have high cholesterol aren't aware of it. So what's important is that you need to make it a point to monitor your cholesterol and take steps to keep them at a healthy level. Now, we'll talk more about how to improve your cholesterol later on in the show. But first, Dr. De Los Reyes, what are the numbers that our viewers need to be aware of?
Well, of course, in terms of the numbers, the decision to treat cholesterol, they are based on targets. And the targets will, of course, differ per each individual, okay? Before treatment goals are actually established, and they're actually according to the risk of the patient, and they're either categorized as a low-risk patient, moderate-risk patient, or a very high-risk patient. For a low-risk patient, your LDL, your most important bad cholesterol, should only be less than 115. But apparently, as your stratification for the risk of cardiovascular diseases increases, your target LDL becomes lower, should become lower. For very high-risk patients, it should only be less than 55.
There's actually, like what you mentioned, there's good cholesterol and there's bad cholesterol. Jake, can you explain this to us?
Dr. Christopher mentioned kanina the roles of cholesterol. Now, when the cells need cholesterol, meron po tayong tinatawag na messengers or taga-deliver ng ating mga cholesterol para pong mga courier service, no. Ang nangyayari po pag po masyadong madami yung courier service na nagdadala ng cholesterol papunta sa ating mga selula, sila ay nagka-clog doong ating mga arteries. So this is the reason why we need to lower down itong mga couriers ito at pagkonsumo ng cholesterol. On the other hand, ano naman yung good cholesterol? So basically, wini-withdraw niya yung too much bad cholesterol na nabubuo doon sa ating mga arteries at binabalik niya ito sa liver para ma-metabolize at ating magamit sa iba pang uses.
That's right, and a significant amount of cholesterol in your body comes from the food that you eat. So if you're experiencing high cholesterol levels, a few changes in your diet can reduce that number and improve your overall heart health. Dr. De Los Reyes, what are some of these changes in diet that a lot of our viewers can incorporate that can affect their cholesterol levels?
But I think the more important would be the portions, smaller portions, no? The amount of food that you eat is actually as important as what you eat. Second, of course, different guidelines would endorse eating more fruits, eating more vegetables, lowering down your salt, lowering down your saturated fats, as well as trans fats, which are commonly found in fast food or processed meats, no?
Okay, those are very good examples, Dr. De Los Reyes. Jake, let's give our viewers some concrete examples kung anong itsura ng isang heart-healthy meal. For example, for breakfast, for lunch, and dinner.
In practical applications, ang pwedeng gawing target ng ating mga manonood is how to replace these sources. For example, saturated fat, trans fat, matataas ito sa mga animal-based products at mga dairy products. So for example, sa breakfast, imbes na kakaiinom kayo ng inyong mga whole milk, pwede po tayong mag-low-fat milk or plant-based milk na very healthy din. And also, ang pinaka nakikita natin based on recent studies, yung effectivity ng plant-based proteins sa pagbaba ng ating cholesterol, no? So ibig sabihin, sana sa isang araw, hindi lamang karne ng hayop ang ating kinakain. Meron din tayong mga sources mula sa protina, mula sa mga plant-based proteins. Pangalawa, again, very important ang fruits and vegetables because if you look at biochemistry, antioxidants from fruits and vegetables can lower cholesterol levels and also they can prevent the negative impacts na nadudulot ng masyadong mataas na cholesterol sa katawan.
Now, diet isn't the only culprit of high cholesterol. Some have naturally high cholesterol levels because their bodies produce too much of it or their bodies are not so efficient in using it. Now, we'll explain how to manage this after a short break. We're your connection to healthcare, so stay with us. If a healthy, fit, young adult finds that he or she has high cholesterol levels, this can be due to familial hypercholesterolemia or FH. FH is when high cholesterol runs in your family. And as you know, cholesterol levels usually rise with age. Someone with FH has high LDL cholesterol levels to begin with, and that can get even higher over time. We'll discuss what to do if you have FH. This is Med Talk Health Talk, where your health comes first. Now, before we talk about FH, whether high cholesterol runs in your family or not, you need to make sure to measure your cholesterol levels. Remember, high cholesterol increases your risk of heart disease and stroke. What are some of the food groups that those with FH, what should they be wary about? Anong klaseng mga pagkain?
Number one, yung type of protein na kinukonsumo natin. No? Sana we choose more of the plant-based options. No? Ito yung mga plant-based proteins natin, garbanzos. Again, mga beans, nuts, and seeds because they don't contain cholesterol. Yung po kasi mga animal protein, sadly, they contain cholesterol and this is type of the cholesterol na nakakapagpataas sa dugo. Second, yung sugar. No? Akala kasi natin pag mataas yung cholesterol natin, ang nire-restrict lang natin yung fat and cholesterol intake. But sadly, in biochem nakikita natin, too much sugar can also be converted to cholesterol, no? So it is something that you can reconsider sa diet natin. Ano ba yung mga top sources ng mga sugars? So yung mga simple sugars, ito yung mga beverages, yung mga dairy products and also yung mga baked goods, no? So this is something na you should be concerned of. And yung mga kailangan yung i-focus or kailangan yung i-replace sa diet o yung ibigyan ng pansin yung mga fruits and vegetables at saka yung mga whole minimally processed foods. Meaning, ito sana yung mga as much as possible, mas fresh and also kayo mismo yung magluluto compared sa mga pre-prepared na at yung mga nabibili na sa market.
That's right. Now, I'd like our viewers to understand how genetics can affect their cholesterol. Dr. De Los Reyes, can you tell us more about familial hypercholesterolemia or FH?
Familial hypercholesterolemia is a disorder brought about by a certain genetic mutation. So it's something congenital, you're born with it, no? But I have to educate our people that familial hypercholesterolemia doesn't necessarily mean that if your parents have high cholesterol and then you have high cholesterol, you're already diagnosed with familial hypercholesterolemia. There's a very strict and there's a very specific criteria in terms of diagnosing familial hypercholesterolemia. More importantly, what we should understand about familial hypercholesterolemia is that our children, there's a 50% chance of transmitting it into our children. And the importance of diagnosing familial hypercholesterolemia is that when you have this disorder, there's actually an abnormality of lipid clearance, meaning our body has some difficulty in terms of metabolizing the cholesterol, and it leads to abnormal accumulation. And the accumulation of excess cholesterol in the body can lead into the development of plaques, which starts out as atherosclerosis, meaning there's narrowing of the blood vessels of the body. And of course, this is the same pathology that is associated with heart diseases as well as strokes. So imagine having that and transmitting it into your family. Early diagnosis and early treatment is very important in its treatment.
Well, some people with FH have physical symptoms, most do not. And that's why it's important that you get tested. Dr. De Los Reyes, let's talk about that. What are some of the tests that are done in order to diagnose FH?
There's always this misconception among patients that cholesterol will always manifest with symptoms. Unfortunately, cholesterol will produce indirect symptoms. No? Remember that when we're treating cholesterol, we're not really treating just the numbers. The reason why we're treating cholesterol is because it has the ability to narrow our blood vessels, and that can develop into cardiovascular morbidities such as heart attacks and strokes. Now, in terms of diagnosing, the initial parameters to determine whether to raise the suspicion whether this patient has familial hypercholesterolemia is our conventional fasting lipid profile. Now, it's not simply just determining the numbers. You really need to consult a medical practitioner for you to be advised if you need to undergo further testing for familial hypercholesterolemia.
Okay. Now, so with Dr. De Los Reyes, can you walk us through taking this test or some of these tests that you mentioned? How do they prepare for it, and how long does it usually take?
The conventional lipid profile will require 8 to 12 hours of fasting. So it's as simple as that. In terms of how early should you be treated or how early should you have your cholesterol lipid profile checked, recommendations in terms of certain guidelines would recommend as early as 18 years old. And it will really depend on, in terms of its frequency, based on the initial results, depending on the initial values.
And while high cholesterol can usually be treated by a change in lifestyle, FH requires a bit more than that. These changes can help, but medications are needed. Now, Dr. De Los Reyes, what are the medications or what are the treatment options that doctors will prescribe for those with FH?
There's many ways, or there's many armamentarium to treat hypercholesterolemia. But I guess the more popular ones would be bundled up in what we know as statins. Statins is a drug that blocks the LDL or your bad cholesterol metabolism.
A lot of people think that those with high cholesterol will also be heavy-set. Is it possible for someone to be skinny, to be thin, but still have abnormally high cholesterol level?
You're correct, Doc. Okay, that's one of the more common misconceptions, that when we associate our cholesterol levels with our physical appearance. Locally, you would often hear patients that would ask me, Doc, ang payat-payat ko pero ang taas ng cholesterol ko, while my brother, who's a very big guy, has a normal cholesterol. The levels of cholesterol does not equate to your body appearance. You'll be surprised that most of our patients, even with a good lifestyle, physically active, doesn't smoke, doesn't drink alcohol, will have very elevated LDL levels.
So leaving high cholesterol untreated can be dangerous. So we're reminding you to please monitor your cholesterol levels and take steps to improve them. Now, Jake, what are some of the possible complications if you don't treat high cholesterol?
The most relevant na nakikita natin na pwedeng complication ng mataas na cholesterol level is the increased risk, the very much increased risk of acquiring severe complications of COVID-19. Because if you talk about biochemistry, no, high cholesterol impacts our antioxidant-oxidant systems, and it worsens, no, pag tayo ay may chronic low-grade inflammation, secondary to high cholesterol, pag po tayo ay tinamaan ng COVID-19, mas malaki yung chance na tayo ay magkaroon ng severe manifestations of the said disease.
And ultimately, a lifestyle change is necessary. We'll talk more about this when we return. Keep it here on CNN Philippines. You're watching Med Talk Health Talk. A lifestyle change may sound like a daunting task, but it's all about making some simple changes to help improve your cholesterol. And more than that, increase your overall well-being. Welcome back to the program. I'm Dr. Freddy Gomez. Now, let's review. Dr. De Los Reyes, what are the factors that affect cholesterol levels?
Well, there's a lot. Of course, in terms of cholesterol metabolism, age is very important. Second, as what was mentioned earlier, genetics. And the presence of other comorbidities such as diabetes, hypertension, this would greatly impact your cholesterol metabolism.
Now, whether it's taking a brisk walk or playing sports, adding physical activity to your day can help begin to improve your cholesterol levels. Jake, how often should one exercise and how long para may makitang change in their overall cholesterol level?
For the most of us, the general recommendation of the World Health Organization is at most 150 minutes per week or more, no? Pero kung kayo po ay already diagnosed na with other conditions, you might consult your physician on specific exercise prescriptions. We must remember that exercise is medicine. The same rigorous effort that you put in taking medications, sana ganun din mag-reflect on how we exercise. I know most of us, some ay nahihirapan to exercise in one session for 20 or 30 minutes per day. So what organizations are suggesting is SIPA, SIPA, Short Incidental Physical Activity. So ibig sabihin lamang nito, for 1 to 2 minutes per hour, every hour na tayo ay gising, kailangan natin gumalaw. These 1 to 2 minute quick workouts need not be those na nakikita natin sa gym. Pwedeng ito ay air brisk walking or climbing the stairs, ganyan, or just moving around your house, no? Kung titingnan natin yung mga pag-aaral, nakikita natin na talagang not moving, yung pagiging very sedentary can increase cholesterol and worsen clinical health outcomes. In fact, di ba, nakikita natin na sitting is the new smoking. So it same goes na rin when we talk about the need for exercise.
Some often find dieting to be hard, but there are good alternatives available for those that have a sweet tooth. Jake, are there treats to help lower your cholesterol?
How do we replace our food choices in a way that it will benefit our heart? If you talk about sweets, because kanina nabanggit natin too much sugar can also be a source of high cholesterol, we can use stevia and other sweeteners to make our beverages, make your own ice creams, make your own juices from fresh fruits and vegetables, because again, these are the most effective ways na mapaganda yung diet natin para maganda para sa ating puso.
That's right, and taking these in adequate quantities is also important. Now, Dr. De Los Reyes, for our viewers who want to start that change but find so much of the data here overwhelming, where should they start? What should they do?
Well, they should always start with something that they're comfortable with. Actually, Jake told us already that the recommended physical activity for each individual is about 150 minutes. So roughly that's about 30 minutes. And even brisk walking will be considered as an exercise, no? Start with something that you're comfortable with, but more importantly, you need to be consistent with these life changes. And starting will always be the difficult part in terms of creating a better lifestyle. But once we become used to it, then it becomes a habit, and that promotes good cardiovascular health.
These small changes will add up to a heart-healthy life. Thank you, cardiologist Dr. Christopher De Los Reyes and clinical dietitian Jake Brandon Andal for joining us today. We appreciate your time very much. Our goal here on the program is to help you better understand the care you need and deserve. I'm Dr. Freddy Gomez, and please do join us again next time on Med Talk Health Talk. Stay safe, everyone, and thanks for watching CNN Philippines.